Добрый день, уважаемый региональный директор доктор Клюге, секретариат Всемирной организации здравоохранения, коллеги, дамы и господа. Сегодня для Казахстана важный день, День Республики. Рахмет за ваши теплые пожелания, поздравления. Хотела еще, позвольте, пожалуйста, поблагодарить вас за поддержку Казахстана и возможность посетить нашу страну для участия в 73-й сессии Европейского регионального комитета ВОЗ. В эти дни Астана стала столицей глобального здравоохранения и первичной медико-санитарной помощи, где мы обсуждали ключевые вопросы, делились опытом, принимали региональные стратегии развития здравоохранения на ближайшие годы. Также мы постарались продемонстрировать вам традиции, культуру, гостеприимство нашей страны. Пусть дни, проведенные в Астане, надолго останутся в вашей памяти. Я прошу вас принять данный сувенир, ладони, объединяющие наши стремления к миру и созиданию, который символизирует нашу дружбу и профессиональное сотрудничество. Благодарю вас за ваше участие и вклад в развитие мировой медицины. А теперь мы переходим к рассмотрению последнего на сегодня пункта повестки дня. На экране отображаются соответствующие документы для данного пункта. Региональному комитету предлагается рассмотреть значение для Европейского региона резолюций и решений, принятых на 76-й сессии Всемирной ассамблеи здравоохранения и 153-й сессии исполнительного комитета и внести свой вклад в соответствующие дискуссии на глобальном уровне. Координатор по связи между исполнительным комитетом и ПКРК сделает заявление по данному вопросу. В мае 2023 году 76-я сессия Всемирной ассамблеи здравоохранения поручила генеральному директору разработать в процессе консультации с государственными членами проект 14-й общей программы работы на 2025-2028 годы в качестве технической стратегии, служащей основой для проведения в последнем квартале 2024 года первого инвестиционного раунда ВОЗ. Соответственно, региональному комитету предлагается представить ВОЗ руководящие указания в отношении стратегической направленности проекта программы работы и представить рекомендации по улучшению предложенного порядка ее разработки. ОПР-14 с опережением на 1 год заменит собой 13-ю общую программу работы на 2019 и 2025 годы. Она будет включать параметры финансирования и всестороннее обоснование запланированных результатов. В ней также будут учтены уроки, извлеченные в ходе выполнения ОПР-13. Она будет представлена на рассмотрение утверждения 77-й сессии Всемирной ассамблеи здравоохранения в 2024 году через 39-е совещание комитета исполкома по программным, бюджетным и административным вопросам, а также 154-й сессии исполнительного комитета. Государствам-членам предлагается предоставить ВОЗ руководящие указания в отношении стратегической направленности ОПР-14 и представить рекомендации по улучшению предложенного порядка ее разработки. С учетом этих руководящих указаний государств-членов будут подготовлены конкретные разделы По каждой из 6 предлагаемых стратегических задач ОПР-14, включающие подробную информацию о сфере охвата, приоритетных мерах, промежуточных результатах и изменениях подходов, необходимых для выполнения каждой задачи, а также анализ заинтересованных сторон. ВОЗ также намерена приступить к обсуждению с государствами-членами возможных конечных результатов и показателей их достижения в рамках каждой стратегической задачи, а также предложения по совершенствованию системы оценки воздействия. К концу октября текущего года будет подготовлен второй документ для консультации, в котором будет представлен общий анализ рисков, также разделы, посвященные сквозным функциональным задачам ВОЗ и задачам в области управления. В начале нашей дискуссии я хотела бы пригласить выступить с докладом господина Брюса Элварда, помощника генерального директора Всемирной организации здравоохранения по вопросам ВОЗ. Господин Элвард, пожалуйста, слово предоставляется вам.
Thank you very much, Madam President. And if I might start our comments by congratulating Kazakhstan on its National Day and just saying what an honor it is to be present on such an auspicious and important day for this country, which indeed has been the cradle of primary health care, much of what we are doing in health systems, especially this week. I have the honor to present to the Regional Committee the ongoing work which is happening across the organization and with our member states on the development of a new vision for global health for the next 4 years, and specifically the strategy and general program of work for the World Health Organization. In this session, I would like to briefly recap the first GPW14 member states consultation document, because of course this was discussed in some detail with you, the member states of Europe, in a briefing on the 4th of September. So we'll move quickly then to developments since the European Pre-Regional Committee briefing on the 4th of September, and spend probably the bulk of this presentation on updates to the strategic priorities, and as well as the potential outcomes that would anchor the strategy based on our ongoing consultations with the member states. Then the last point will be, as Madam Chairman has said, to align on next steps as we move forward. On this slide, on the left-hand side, you can see the 14th General Program of Work document, the first consultation document, which was issued, actually that date's not correct, it was issued on the 18th of August, and has formed the basis for consultations in this and other regions, as well as with partners. As you're aware as well, just to recap, on the 4th of September, we had a brilliant discussion with you, the European member states, a pre-RC briefing on this document, in which we discussed the context for developing a new GPW14, which of course is not only the first WHO investment round to anchor that, but more importantly, the rapidly changing world in terms of the challenges we're facing, the crises we face, the fiscal constraints, but also the changing demographics and epidemiologic drivers, as well as technologic drivers to which we have to respond as an organization, as member states. We discussed as well in some detail the overarching goal of GPW14 to promote, provide, and protect health, as well as the 6 strategic priorities I will recap in a few moments, and the unique role of WHO. Then finally, we aligned, of course, on a broad consultation process and the co-creation of outcomes and engagement of partners. Now, since the briefing with you, the Euro member states on 4th of September, as you can see on the left-hand side, there's been an extensive consultation process with now over 11 consultations with member states at both global, regional level, with many of our key implementing partners and your implementing partners in the UN and beyond, regional development banks, and others. Next week, we will kick off a more extensive consultation with civil society, youth groups, private sector. On the right-hand side of the slide, I would like to share some of the inputs we are receiving and the guidance, because it's important to ensure this reflects also the perspectives of this regional committee. What we're hearing is a broad alignment on the context, as we again heard yesterday in the response to the regional director's report, the goal and strict strategic priorities, welcoming that we are setting a global agenda and vision for health and well-being with this document, but at the same time focusing on WHO's role. The co-creation process welcomed, the importance of building on GPW 13 and the SDGs, but at the same time looking to the future and future-proofing the work of the organization and global health. Big emphasis on strengthening of country and regional offices because of the changing nature of global health and the crucial importance of the leadership roles at those levels. We also heard an emphasis around key issues, a number of which were emphasized yesterday: AMR, NCDs, systems strengthening, gender equity rights. Of course, the crucial thing being now to move forward with the development of outcomes that would anchor our joint work with you, in support of you, the member states, and with our partners. Enunciating in particular, of course, the WHO-specific contributions. So before moving to that next step, I'd like to also just recap what the goal and strategic objectives are at this point. There will be some adjustments to the language of these strategic objectives, but the big direction now seems to be increasingly aligned with across our member states, with a focus on climate, determinants, essential health services, financing, preparedness, and of course capacity to respond, as you see reflected in the strategic objectives on this slide and in the background documents. The other big thing we've been hearing now increasingly is it's time to move to this next step and jointly develop the major outcomes for each strategic objective, which would anchor our joint work. So with this second section of the presentation, I would like to update you as to where we are in this regard and set the basis for further consultation on these. In response to the request of you, the member states, we have set up a WHO-wide three-level working groups for promote, provide, protect. All of this work is coordinated by an organization-wide steering committee, to which my colleagues on my left-hand side here, both Corinne and Srinen, are part of, as well as other country office representatives from Euro. So it's very much organization-wide. And it began working on potential outcomes for each objective, as well as specific WHO outputs. The outcomes, of course, are crucial to get right, because this anchors the work of and the vision of the member states, supported by WHO and our partners, and then we come to our specific work under outputs. So the working group provided, first of all, some draft outcomes. We assessed and refined these, as you can see on the right-hand side of this slide, as to whether or not they met the WHO definition for health outcomes. They reflect how member states plan and organize and what they're prioritizing, alignment with the global health architecture, and whether they were crisp and clear enough to support the investment round. And then we began a further consultation with member states on the alignment and co-creation of these just last Friday. So what you are seeing now is really hot off the press, as we say in English. Now, with this next slide, I would like to highlight one of the first major issues and adjustments that we will have in this GPW versus previous GPWs. As you can see on the left-hand side, under GPW 12 and GPW 13, our results chain and our impact and accountability frameworks really focused on outcomes that were specific health outcomes, the increase in a health service or the reduction in a health risk factor, and of course reflected these as being the joint work of member state, secretary, and partners, as you can see here. Now, as we're developing GPW 14, you, the member states, our partners, and of course WHO staff themselves, emphasized that this outcome definition does not capture vital health system capacities that will be crucial to achieving the health outcomes. And here we're talking about many of the themes we heard yesterday repeatedly in your interventions: health workforce, health financing, financial protection, digitalization, and that we would need to adjust and complement the outcomes in this GPW and in this subsequent program budgets with specific outcomes for essential health systems capacities. And this was a major, let's say, development, because it helps put on par our investments and work on the system's capacities with the specific health outcomes, which is really important if we are to progress on these areas, prioritize them appropriately in GPW 14. So this was a key decision for which we are getting a lot of support from member states and will anchor our work as we go forward. Now, the second thing that we did on Friday was to present to member states for each strategic priority some draft outcome working proposals. I won't go through all of these, but I would just like to highlight under climate, there was a draft proposal for an adaptation as well as a mitigation outcome. Under determinants of health, there were 3 outcomes proposed in the area of addressing determinants themselves, reducing key risk factors, and then empowering populations. In the area of provide and the 2 strategic priorities there, these have been slightly reworked, as you can see on the left-hand side, to reflect a strategic priority in enhancing service coverage and financial protection, which would be distinct from key work to enhance essential health system capacities. And here, 2 sets of potential outcomes were proposed. First, in terms of enhancing access to a comprehensive service, package service covering NCDs, mental health, communicable disease, etc. Reducing financial barriers, catastrophic spending. And then on the bottom, you see these outcomes for essential systems capacities, which would reflect the emphasis on workforce financing digital, as well as reorientation of our health systems work to a PHC approach to accelerate UHC and health security. We also posed with member states on Friday 2 key questions as to whether we should break out under 3.1 on this screen each of the major elements of the service package, and similarly, should we break out each of the key system gaps that you see below under 4.1. Initial direction was no, perhaps better to have it integrated, but we will be looking for further feedback on that in the coming days. And then in the third area of protect and the strategic priorities of prevention, preparedness, and detection and response, the outcomes you see listed here were discussed, and frankly, relatively broad concurrence, or at least not pushback, let me say, in that initial consultation, because this aligns very much with the work we've been discussing over the last 2 years in the context of COVID and in the context of accelerating work to strengthen capacities to address emergencies. So the last thing we discussed on Friday was that now, as we work through our outcomes, we will be slightly adjusting the strategic objectives in ways that I referred to earlier in the presentation, and I just highlight on this slide to make the 4th one more focused on essential systems capacities. So with this final slide, I'd just like to update the timeline, some of the key dates in the development of GPW 14. First, we are looking forward to member state comments on the draft outcomes by 30th of October, because it is crucial that these actually reflect the directions, priorities, and outcomes that member states themselves are gunning for, so that we are contributing appropriately to those and aligning the health architecture to that and health ecosystem to those. And then we have pushed out a little bit the date for the second consultation document to mid-November to make sure we can have these draft outcomes updated, as you see on the right-hand side there, to include also priority WHO outputs, what we, the organization, specifically will be delivering towards these outcomes, the management, technical functions, and also further detail on a theory of change. I would also like to highlight that it is only in the first week of November that we will get the report on the evaluation of GPW 13, so we need a little time to incorporate some of the additional findings from that as we put together the updated second consultation document. And so finally, just like to appreciate any perspectives we may receive from the Regional Committee on the evolving GPW14, the goal, the strategic objectives, the draft outcomes, and the process. These would be most appreciated. And finally, if I might again take this opportunity to appreciate Dr. Kluge, your direct involvement in this process, support for it, and the tremendous engagement of the regional office staff and country representatives who have been part of the development process so far. Finally, I would like to say, Madam Chair, that I'm joined today by one of my co-chairs in this process, of course, who is Dr. Jeremy Farrer, who I believe is sitting just to the right here, and it would be great if he might be able to intervene during the discussion on some of the key points that may be raised. Thank you. With that, I might, if I could, Madam Chair, pass the floor to the gentleman on my left, Mr. Srenan, who works with us in the development process and will be able to add the Euro perspective.
Thank you, Madam Chair. Thank you, Bruce. Ladies and gentlemen, dear delegates, I was asked to add some Euro perspectives on the development of the 14th General Program of Work. And in the interest of time, let me highlight two important points from the regional perspective. First, Euro actively contributes to the GP14 development. Directors, senior regional staff, as well as WHO representatives from the country offices are members of the steering committee, the 3 working groups on strategic priorities, and of the global network, which is developing the result framework, all the way down to deliverables and to the measurement system and the evaluation system for the new global program of work. Second point is that I would like to make is that actually the European program of work anticipated much of the content of the global program of work 14. EPW was an important step towards strategizing on an updated, forward-looking health agenda, which puts health in a broader societal context and promotes evidence and science-based, innovative, and agile thinking and working. From the European High-Level Forum on Health in the Wellbeing Economy, the Monti Commission, to the work on environment, climate, and health, or digital health, and everything in between, the work of this regional office already advanced the shaping of an updated global health agenda, primarily by providing solid evidence and science base to inform the development of a global vision for a better and resilient future. So those would be two key contributions of the European region to the new global program of work. Now, together with a robust and active engagement of the European member states in shaping the new global program of work and linking it to the investment round next year, this should result in a strong co-created global program of work and at the same time a stronger, agile and fit-for-purpose WHO. It is in the interest of the regional office to provide every opportunity for the European member states for an active and meaningful participation in discussions about GPW14. And time permitting and format permitting, we would like to see a written consultation in the European region as soon as the second version of the paper is available. Thank you very much. Thank you, Madam Chair. And I will pass the floor to Skender Sila, the WHO representative here in the Republic of Kazakhstan, who is member of one of the working groups, to say a few words on his perspectives.
Thank you. Thank you, Serjan. Madam Chair, dear Minister, let me start by saying Happy Day of the Republic of Kazakhstan, wishing health, prosperity, and peace to your great nation. At the same time, I would like to express highest appreciation and thanks for the great support and collaboration that you are providing to WHO country office since 1st of October that I have been assigned to this country. Dear Hans, thank you very much for entrusting me to represent WHO to this great country. Ladies and gentlemen, WHO's vision should be important and very relevant to countries' work. As DG stated in the opening remarks of the Primary Healthcare Conference, it is not political declarations, statements, or reports that make the difference. It is actions by each and every one of us. Therefore, our action must be measured by clear indicators to evaluate progress and results. Obviously, there should be also continuity, both regarding sustainable development goals and beyond, as well as GPW13. Continuity means also incorporating lessons learned from the pandemic, how to build back better. When GPW is finalized and endorsed by member states, still the key question remains to be answered and addressed on every day of our work at country level. How do we reach everyone on span? From country leaders to school students, from nurses to minors, from rich to poor, in order that no one is left behind. Let me share some experience of very practical actions that we do at the country level. At the policy level, we engage not only with the health sector, but also with education, environment, agriculture, economy, and digital development, facilitating initiatives related to non-communicable diseases, One Health, health emergencies, health taxation, and many more. At the beginning of this month, together with colleagues from UN agencies, we addressed the Kazakh parliament at the meeting dedicated to SDG 3 and 4, and I will focus here advocating for better intersectoral action on reducing tobacco and nicotine use, introducing taxation for sugary drinks, and enhancing universal health coverage and financial protection. We also work on engaging society and activists to promote and disseminate our values and evidence-based information. The latest example is the nomination of the youth volunteers who will work on promoting immunization and fighting infodemics using the WHO materials and guidance. We believe that peer-to-peer approach could be more effective and efficient in reaching specific group of population. Indeed, this is only tip of the iceberg. In order to make the promote initiative successful, we need to engage wider community and gain trust. Our arguments should be based on solid evidence and knowledge generated in collaborative, multidisciplinary environment. We need to use concise yet compelling language, especially for decision makers, experts, and population groups who does not possess specific knowledge in medicine or public health. Despite challenges, I'm sure that we all will unite to promote health, and that will succeed. Now, I would like to invite my esteemed colleague, Corinne, Executive Director at the Regional Director's Office, to take the floor.
Thank you very much, gentlemen. So actually, GPW14 and the investment round are the two sides of the same coin. So we thought that we should combine the presentation on GPW14 and the investment round. So I'm going now to talk within a few minutes. I'm sorry that's the last presentation of the day, and I will try to do it in a few minutes. The investment round takes its roots in an important process which started a few years ago with the establishment of the Working Group on Sustainable Financing. Euro member states played a central role in this context. You would recall that the Regional Committee for Europe adopted resolution EUR/RC71/R6, WHO Sustainable Financing in the European region, paving the way for the endorsement by European member states of the recommendation of the Working Group at World Health Assembly 75. A key recommendation was to assess the feasibility of establishing a WHO replenishment mechanism. At this year's World Health Assembly, member states adopted decision World Health Assembly 76/19, making the organization of the first investment round in November 2024 possible, with 4 objectives. 1, improving the financial sustainability of the organization as a complement to progressive increase of assessed contribution. 2, broadening WHO donor base. 3, increasing internal efficiency in resource mobilization, and 4, driving political commitment to health. The investment round and the GPW14, as I mentioned, really go hand in hand. The development of a robust GPW14 with a well-articulated result framework was a precondition for the organization of the first investment round in November 2024. We understand our responsibility in that context and stand ready to play our role here in the European region. On the other hand, for the GPW14 to be successful and impactful and lead to the expected results, WHO needs to fully fund its program budget in 2024-2028. The investment round is a unique opportunity to have the best possible conditions for the full delivery of GPW14 at the 3 levels of the organization. The investment round will rally all partners around the GPW14 to accelerate progress towards the achievement of the SDGs, including SDG 3. It will allow us to safeguard political support and keep global health on the agenda in the post-COVID-19 era, and to fully fund the GPW14 while increasing flexibility and predictability of resources, leading to increased organizational efficiencies and cost effectiveness. For the first investment round, all types of voluntary contribution will count, independently from their level of earmarking. We obviously hope that the funding provided would be as flexible as possible, considering the challenges that earmarking represents for the organization. In that context, I would like to commend the Euro member states for having walked the talk until now by providing increasingly more flexible and predictable funding to WHO over time. In the current biennium, out of 14 contributors providing core voluntary contributions, what we call the CVC, 11 are Euro member states. Thank you very much for that. The first investment round event in November 2024 is being organized together with you, our member states. Extensive discussions have taken place at PBAC, EB and World Health Assembly earlier this year, and a first member state consultation was organized last month. Regional co-hosts are being identified in the 6 regions, and the investment round is approached as a corporate exercise with all 3 levels of the organization working towards the same objectives. Existing WHO resource mobilization staff are contributing, and planned events will be leveraged to keep the planning and execution of the investment round as light as possible. Having a quick look at the timeline, now you can see the different milestones ahead of us. A paper has been developed and sent to all member states for comment last week, with a deadline for comments on 27 October, which is this Friday. We invite you to take part in this exercise. There will also be a member state briefing organized by our headquarter colleagues on November 3. Now, on the regional front, a regional online briefing and consultation with Euro member states will be organized after the regional committee, and we will shortly get back to you on the dates and modalities of this consultation. We really hope that Euro member states will actively take part in this consultation to ensure that the investment round is indeed a co-creation between member states and the Secretariat. The Executive Board in January 2024 will be an important milestone, and we hope that it will lead to the approval of the plan for the investment round and allow us to move to phase 2 of the process and a successful investment round in November 2024. Thank you, Madam Chair.
Спасибо, господа Брюс Эйлвард, Сардан Матик, Искендер Сыла и госпожа Корин Капуана за содержательные презентации и размышления. Теперь хотела бы представить возможность выступить для комментариев, замечаний по теме выступающих. В первую очередь хочу представить слово государства-членам. Пожалуйста, кто хочет выступить, просьба поднять свои таблички. Слово предоставляется Испании.
Thank you very much, Madam Chair, Director General, Regional Director, Excellencies, ladies and gentlemen, I have the honor to speak on behalf of the European Union and its member states. The EU and its member states welcome the following: that the consultation process proposed to develop GPW14 also involves the regions and the respective member states. The development of the GPW14 comes at a critical time where health issues are challenged by numerous interconnected complexities, such as economic downturn, changing demographic patterns, humanitarian crisis, conflict, climate change, pandemic risks, inequity and insecurity, health workforce crisis, and sustainable health systems due to lack of financing. How can we continue to guarantee the highest level of health for all in view of these threats? A broad focus that combines attention to health systems, public health and crisis management, combined with health in all policies approach and leaving no one behind, should remain our guiding principles. The health landscape is changing with rapid speed. Important evolutions, such as in the field of digital health, AI, the human, animal, and environment interface, to name just a few, need adaptation, including from the global health perspective. We welcome the strong link that is made between the draft GPW14 and the investment round. The proposed structure articulated around the 6 objectives appears attractive in terms of incentivizing and earmarked voluntary contributions from donors at the occasion of the first investment round to take place in 2024, after the ongoing consultations of its parameters with member states are finalized. We also particularly welcome the impactful integration of gender equality, equity, and human rights-based approaches in the GPW14. The EU remains committed to the promotion, protection, and fulfillment of all human rights, and to the full and effective implementation of the Beijing Platform for Action and the Programme of Action of the ICPD and the outcomes of the review conferences, and remains committed to this RHR in this context. And it is the clear expectation of the EU that the GPW14 will remain fully committed to all mentioned key aspects of gender equality and human rights in the same vein. We would seek more information on the strong focus in the GPW on WHO's operational intervention in countries and its relative weight as regards to norms and standards. Safeguarding normative functions is key. WHO has a role serving all member states. Concerning the role of WHO on the ground, while we welcome a well-tailored advisory role for WHO countries' offices on national public health policies, we would refrain from a substitution role. We are thus interested to learn more about what is meant by increasing the operational role of WHO's work at countries level, including in humanitarian settings, and how it should be understood in terms of collaboration with other actors. An operational role with regard to delivery of health services should be taken by WHO in exceptional cases only. We do, however, agree that the WHO can help member states work better with communities and non-state actors to achieve health goals. GPW14 aims to be the roadmap for the world, but WHO does not operate in a vacuum. How does WHO envisage to engage and involve global health actors in an inclusive and transparent manner as it aims to set a health agenda for all health players? Finally, we look forward to the consultative process on the proposed results framework, including the GPW14 outcomes and related indicators and targets. We stand ready to engage constructively. Thank you very much, Rahmet, and a happy Republic Day of Kazakhstan.
Спасибо. Слово предоставляется Швейцарии.
Merci Madame la Présidente, Monsieur le Directeur régional, Mesdames et Messieurs. J'aimerais, sous ce point de l'ordre du jour, puisque nous traitons des questions qui seront traitées aussi au niveau global, faire des commentaires sur 3 sujets. Le premier, sur le programme général de travail. Merci pour les présentations qui ont été faites. La Suisse s'engagera pour que ce document soit pertinent, succinct et surtout aide l'organisation à faire son travail au mieux. Deuxièmement, nous sommes reconnaissants des indications qui nous ont été données sur la ronde d'investissement, un sujet qui nous tient particulièrement à cœur et où nous sommes convaincus que la région européenne peut jouer un rôle important. Et dans ce sens-là, nous comptons sur l'engagement de l'OMS Europe pour travailler dans ce sens-là. Et puis troisièmement, je l'avais déjà dit hier, des précisions sur la santé et la paix, puisqu'il sera un des sujets de l'ordre du jour de l'année qui s'ouvre au niveau global. Nous l'avons entendu pendant ce Conseil régional, il n'y a pas de santé sans paix et pas de paix sans santé. C'est pour cette raison que la Suisse, en collaboration avec le sultanat d'Oman, continue à s'engager activement pour l'initiative Santé et Paix. Ce sera une priorité de notre siège au Conseil exécutif. Cette initiative vise à renforcer le travail de base de l'OMS, qui constitue à protéger la santé des populations dans des situations d'urgence, ainsi que dans des contextes plus larges au niveau mondial. Les récents événements dans le monde nous ont montré une fois de plus la nécessité cruciale de cette initiative. En effet, l'initiative a été conçue comme un moyen de mieux répondre aux facteurs sous-jacents des besoins sanitaires critiques dans les contextes d'urgence, étant donné qu'environ 80% de la charge de travail humanitaire de l'OMS ainsi que 70% des épidémies auxquelles l'OMS réagit ont lieu dans ces contextes. L'initiative vise à renforcer les capacités de l'OMS à travailler de manière impartiale, à protéger l'espace pour des soins de santé impartiaux, conformément à l'éthique médicale, aux principes humanitaires et au droit international. Pour la Suisse, il est de la plus haute importance que l'OMS poursuive son important travail dans ce domaine et que ce travail soit fermement fondé sur un mandat clair donné par ses États membres. Je l'ai dit avant, la thématique sera à l'ordre du jour du 154e comité exécutif en vue de la 77e Assemblée mondiale de la santé. Sur la base de la décision de la dernière Assemblée, le secrétariat est en train de préparer le rapport de progrès demandé à l'aide de consultations informelles qui sont en cours. La Suisse s'engagera activement. Nous menons déjà des échanges informels pour préparer la discussion. Nous nous tenons donc à disposition pour toute réflexion et question à ce sujet. Je termine en vous souhaitant aussi de la part de la Suisse une belle fête nationale aujourd'hui et vous remercie.
Рахмет. Слово предоставляется Словении. Подготовиться Норвегии.
Thank you very much, Madam Chair, and allow me to first express a warm congratulations for the Republic Day of Kazakhstan. Slovenia aligns itself with the statement made by Spain on behalf of the EU and appreciates the opportunity to provide further input into the developing of the 14th General Program of Work at this RC. For our country, this is one of the most important processes currently underway at WHO. From a global perspective, it is important that WHO keeps positioning itself as the central global health agency and as such advocates for health beyond the health sector. With looming challenges such as climate change, conflict, economic recession, all of which affect health outcomes, we need the WHO to keep reminding the world that for prosperity, health is essential. We're encouraged to see that the country focus, which is something already very present in our region, will continue. Slovenia fully agrees that to reach the SDGs, we need more implementation on the ground, and for this, support of WHO is crucial. We must be better equipped with the how when we aim to reach our goals that we assign to. Our region struggles with the burden of NCDs and mental health. Slovenia strongly supports the focus on addressing risk factors and health determinants. Understanding and addressing commercial determinants, for example, for us is still a challenge. We need WHO to work with us in developing tools and increasing our capacities if we want to implement sometimes very challenging best buys. Slovenia believes that an important driver of change is working hand in hand with the people who are affected by the policies we adopt and with organizations representing them. Working together through the mechanisms of social participation can importantly contribute to transformation of health systems based on trust. Service delivery and access to health services for the most vulnerable cannot be addressed appropriately without them participating. Social participation can also contribute to increasing health literacy, health promotion, effective risk communication, to tackling vaccine hesitancy. It can contribute to addressing determinants of health and also bringing us closer to health equity and fairness. When it comes to health systems, we must ensure that we offer the best possible quality of care, and this should be more emphasized in the GPW14. Thank you again for giving us the opportunity to contribute. Slovenia looks forward to the next consultations and the corresponding documentation. Thank you.
Спасибо. Слово предоставляется Норвегии, подготовиться Российской Федерации.
Thank you, Chair. President, Regional Director, dear colleagues. Norway fully supports the development of the WHO investment round as a complement to the increase in assessed contributions to secure more sustainable, predictable, and more flexible funding of the WHO. This is not a tool to increase WHO's available budget, but to enhance the quality and the sustainability of the financing and to make WHO more effective and efficient and democratic. In our view, the goal should be that a substantial part of the pledge contribution are fully flexible. We appreciate the preliminary analysis showing a potential for efficiencies and savings. The results framework should be able to include aspects of efficiencies and improved governance. The WHO Secretariat should, for example, be able to demonstrate how the WHO can hire technical staff on longer contracts, how the gaps in funding in WHO's budgets are evened out across areas and units, how directors and technical staff can use time on technical work instead of fundraising, etc. We welcome the plan's inclusion of an evaluation aspect, which will be important to make improvements to the initial concept. As we have underlined in previous discussions, WHO's unique nature as a normative agency must be maintained. The results framework will need to accommodate this. The investment case should be closely linked to the GPW to ensure it is the decisions in the EB and the WHA that set the priorities of the organization. We must also think strategically about how we organize and frame the investment round to make sure that it comes as an addition to the process to continue increasing the assessed contributions. The proposed outline for the process seems sound, but we still underscore the need to give sufficient time for consultations, including providing documentation for such consultation in a timely manner. Thank you.
Спасибо. Слово предоставляется Российской Федерации, подготовиться Финляндии.
Уважаемая госпожа председатель, уважаемые коллеги, Российская Федерация благодарит ВОЗ за представленные презентации, а также за проделанную в межсессионный период работу по формированию УПР-14. Новая программа работы направлена на укрепление, защиту здоровья и благополучия населения, что отвечает целям и задачам, которые ставят перед собой страны-члены ВОЗ, учитывая ведущуюся на площадке организаций работу по реформированию глобальной архитектуры здравоохранения. Мы поддерживаем выполнение 6 поставленных масштабных стратегических задач в рамках УПР-14. Для нас особенно важно, что новая общая программа работы содержала четкий план действий с конкретными целевыми показателями и сроками по достижению поставленных задач. Считаем, что при разработке целевых показателей мониторинга УПР-14 следует использовать уже существующие программы и стратегии ВОС, а также показатели мониторинга целей в области устойчивого развития. Считаем излишним включение в УПР-14 разработку мер по вопросам климата. В рамках своей работы ВОС не должна выходить за рамки мандата и дублировать функции других профильных структур и программ ООН. Также хотели бы обратить внимание на сохраняющуюся проблему недостаточно прозрачного процесса подготовки программного бюджета, который является ключевым элементом любой программы работы. На данный момент мы имеем только оценочные значения программных показателей. Вместе с тем, отсутствие детальных планов по распределению финансовых средств с точки зрения основных статей расходов сказывается на возможностях государств-членов вести предметные дискуссии о деятельности самой организации. Рассчитываем, что при разработке УПР-14 секретариат также сможет перенять лучшие практики системы ООН в области разработки бюджета и сделать его прозрачным. Благодарю за внимание.
Слово предоставляется Финляндии, подготовится Словакии.
Thank you, Madam Chair. Finland aligns itself with a statement of the European Union and its member states delivered by Spain. Finland appreciates the consultative process for the development of GBW 14. We find the approach there to be comprehensive and ambitious. It's important to recognize the dramatically changed world as the draft document does. Recognition of climate change and its impact on health, well-being, health security and health systems is important. Additionally, the impact of other megatrends such as innovation and digitalization, demographic changes, migration and the security situation should be assessed in relation to the right to health for all and the Agenda 2030. We support the wide perspective on health and well-being outlined in the draft, as well as policy coherence across sectors. Health outcomes can only be achieved in collaboration with and by investments from other sectors, and this will require clarification of roles and responsibilities of different actors. It is important that the GPWHA 40 continue the work of reflecting linkages between health, well-being and economy. There is need to continue building common understanding between health and well-being and the economy. Moreover, we need awareness of concrete solutions for implementing the economy of well-being in member states, taking into consideration the recommendations from the Commission of Economics and Health for all. It is also important that WHO must remain relevant to all member states. The normative functions need critical support while the focus is geared towards country-level actions. Thank you.
Слово предоставляется Словакии, подготовится Франции.
Madam Chair, distinguished delegates, Slovakia aligns itself with the statement of Spain made on behalf of the EU and its member states on this agenda item, and we fully support the questions and comments raised in the statement. Slovakia welcomes the GPW document and presentation by Dr. Bruce, and we appreciate improved and without any doubt a new development with consideration of essential health systems capacities as a new pillar of this segment, which is very important. We would welcome more information on how the indicators methodology was developed, and with a focus on the region and, of course, very diverse interdevelopment and challenges recently, and the opportunities to implement this ambitious GPW program in the practice and the practical way. How we will we be able to measure these outcomes on the behalf of different categories of the countries or each country, how we will be able to track the progress in the development when the implementation process will start. We need to prepare for that because this is only consultation about the document itself, but we need to have a translation framework with also clear indications, because the general indicators there are very clear or let's say aggregable, but on behalf of different countries with different challenges, it could be really something different expected. And until this will be not very clear, so it will be just, let's say, use the language of fantasy, just a bank with fictive money, because this will be not deliverable at all. So in this regard, Slovakia would like to request not only regional office, but hand in hand also with WHO headquarter relative departments to organize intersessional briefing and also discussion on the framework development, and also discussion about the best way for the implementation and which kind of translation and knowledge translation and mobilization procedures we can use for adaptation of potentially approved GPW 14. And the second question is, and this is my last question, how we can also better help facilitate this process as the member states, but also in the room they are international organizations and non-state actors and the IAS delegates. So we would welcome perhaps your opinion. This is open-ended question, what you would expect from us and how we can perhaps help this process will be really alive and successful. Thank you.
Слово предоставляется Франции, подготовится Болгарии.
Madame la Présidente, Monsieur le Directeur Général de l'OMS, régional de l'OMS, pardon, chers délégués, tout d'abord la France vous renouvelle tous ses voeux, Madame la Ministre, chère Ajar Guiniat, pour la fête de la République du Kazakhstan. Respublika Kune Khut Belsin. La France s'aligne avec les positions de l'Union européenne exprimées par nos collègues et amis espagnols et félicite le secrétariat pour son travail sur le projet du 14e programme général. Plus spécifiquement, la France soutient avec force les réformes de financement de l'OMS entreprises depuis 2022. La décision historique de parvenir à une hausse conséquente de la part des contributions obligatoires fut un premier pas crucial. Mais pour améliorer encore le financement de notre organisation et lui permettre d'accomplir son mandat de la plus efficace des manières, d'autres réformes sont possibles et souhaitables. Parmi elles, la mise en place d'un cycle d'investissement est une excellente initiative. La France y est très favorable et nous nous félicitons que la dernière Assemblée mondiale de la santé ait invité le secrétariat à planifier un cycle d'investissement pour fin 2024. Il s'agit d'un moyen adéquat pour organiser les contributions volontaires faites à l'OMS et augmenter la prévisibilité du financement de l'organisation. Utiliser les contributions issues de ce mécanisme pour alimenter le segment de base du budget de l'organisation est une option très satisfaisante. Nous sommes en accord avec le processus proposé par le secrétariat. Toutefois, les modalités concrètes de ce premier cycle d'investissement, notamment concernant la co-organisation des événements de reconstitution, peuvent être encore précisées. Par conséquent, nous attendons le projet de plan complet préparé par le secrétariat. Enfin, nous remercions le secrétariat pour sa proposition de calendrier. Je tiens à souligner qu'il est important que le secrétariat prévoie plusieurs réunions préparatoires, au moins 2 ou 3, avec les États membres avant l'événement de reconstitution de fin 2024. Je remercie encore le secrétariat pour tout son travail. Cette réforme est importante pour la France et vous pouvez compter sur notre soutien. Je vous remercie.
Слово предоставляется Болгарии.
Thank you very much. Distinguished Chair, dear colleagues, Bulgaria aligns itself with the European Union statement on the topic made by Spain. First of all, I would like to congratulate the Honorable Minister of Health, Dr. Giniat, and the staff of the country office in Kazakhstan, led by Dr. Skender Sila, for the National Day, and wish all citizens of the great Kazakh country good health and good mental health. Bulgaria welcomes the presented vision for the GPW14 on the strategic technical areas proposed in the document with clearly formulated strategic goals. We consider it necessary to include an accountability part in the program to provide for tracking the costs of the key functions of the WHO and ensure transparency. The leading role of the WHO on the topics of NCD and mental health should be outlined, specifying those responsible for each of the results at the relevant levels, globally, regionally, and the specific requirements for national authorities. Goals related to climate change and health are also important, as this is the focus on health inequities. We believe that it's important to continue the consultative process with all stakeholders and complete the development of a strategy document fit for purpose that will support countries in the process of implementing the SDGs and ensure access to essential health services and intervention through people's lives, and especially to disadvantaged people. Thank you for your attention.
Не вижу табличек. Выступающие есть еще? Если нет, хочу дать слово международным партнерам и негосударственным структурам. Не видно табличек, желающих нет. Разрешите мне представить слово господину Брюсу Эйлварду, доктору Корин Капуана для ответных выступлений. Пожалуйста.
Thank you very much, Madam Chair. And if I might first just start by thanking the member states for the comments and for the guidance. When you get on an airplane to come such a distance and you put so much investment with your regional colleagues in the preparation of a session, you hope for good inputs and help, but this goes well beyond that. So really a sincere appreciation for the insights. We heard very clearly the importance you give to the process being followed in the development of GPW14, the emphasis that this is in fact the member states document need to lead on this. We're pleased that the process has met your expectations. And I'd like to say we really welcome at the global regional level any further ideas you have or requests for engagement on specific aspects, and we are very, very keen to make that work. On some of the specific comments that were raised, please be assured that on the issue of gender equality and rights, we would like to highlight the centrality of that and how integrated it is in the development of GPW14. As I mentioned in the introduction on our process, we have 3 organization-wide working groups around promote, provide, protect. And we have GER colleagues from each part of the organization as part of that to ensure this is not an afterthought, but that we are addressing issues of equity, gender, rights as we develop GPW14 and its outcomes and the outputs that WHO itself would be accountable for. Because frankly, unless we do it that way, we're not going to solve that problem. So very much committed on that point. A second major point that came up in the discussion was ensuring we remain true to the normative role and function of WHO, especially as we strengthen our country presence and regional presence. And we want to really assure our member states that that is exactly the intent in strengthening our country offices. as we develop normative products, we have to ensure we are developing the right ones, they're having the right impact, and they are being properly integrated in the work at country level. And one thing we have learned as a normative agency is some of our normative work, it's co-opted for the interests of others, it's corrupted sometimes, and there are huge delays in translation of policy into practice. The strengthening of our country offices and presence is about establishing a core, predictable country presence so that you, our member states, can ensure our normative work is the right work, ensure that it is feeding into practice as rapidly as possible. As we talk about an operational role for the organization, as emphasized by by some speakers, this is really in the context of special situations wherein the member states require that role. We are, in the context of humanitarian emergencies, we are the global health cluster coordinator. That is our function, to coordinate, facilitate the works of others, which we do. But in that role, we are also a provider of last resort. When others cannot step in, it is our job to make sure that the most vulnerable are protected in these settings, and we are committed to that role. We have also learned, as we have scaled up the health response in recent crises, much of the requests, we heard the concern that you had about a replacement function of WHO. We have no intent to play that role. But what we are hearing from our partners is health is complex. It is even more complex than delivering food and other things and interventions. We need more help from WHO to get this right, especially with the complexity of NCD's management in crises and other similar ones. And that is the role really we're looking to play. But please be assured, this is to increase the impact always of our normative work while ensuring we are doing the right normative work. This needs to happen more quickly, which means stronger presence. So that is really what we're after. A point was raised about ensuring that we recognize WHO doesn't operate in a vacuum. We absolutely are aware of that. So the consultative process, as you have asked, is involving our core partners, our core implementing partners, other sectors even, to ensure that they can tell us what is of value from WHO as we move forward, that we don't replace, we don't operate in a vacuum. And we will try and capture that in the theory of change that will be an integral part of the GPW as we go forward. So those were some of the key points that we heard. We heard about building on existing works and mandates, of course. We heard a number of comments about climate. We heard both enthusiasm that WHO move on climate and concern that we don't do the work of others. And that is exactly what we want to achieve in GPW 14. We will need your help as we design the outcomes to ensure we are focused on the right area where we can have the greatest impact. But ultimately, climate change is a health issue. It's an existential threat to human health. And we have got to be both lead advocates, leaders on evidence, and also doing our part to adapt as we go forward and mitigate within the system. So we feel we have to get that piece right, and that's what our commitment is, working with you. The last comments I might make on some specific points we heard about health and well-being and the economy, building in the Commission on Economics of Health for All, absolutely crucial. We will do that. We also heard about ensuring as we move forward on the GPW and the outcomes, we are also thinking about measurement and impact. And as I think most of you are aware, we've had a number of consultations with you about how do we improve our impact measurement as we go forward in the context of GPW 14 as well. So improve and adapt it as we go forward while not generating new or a minimum number of any new reporting requirements on member states. So it's more an adjustment, we think, than any fundamental changes. The last point, if I might just reflect on, was we were asked, how can not just member states, but the partners with us better facilitate the process? Two key things. The outcomes have to be a global agenda. This is what's important to you, our member states. Like, these outcomes are what you're gunning for the next 4 years. So please be very involved in looking at these and giving us feedback by the 30th of October, because we are committed to work to those and work with our partners to those. So the outcomes and shaping those, they have to be relevant for member states, not just us. The second thing is that emphasis on in delivering those outcomes, your outcomes, what do you need from WHO? Because that will be our outputs, which norms and standards, what convening roles, etc. So with that, thank you very much for the guidance we've received. Apologies if I've not touched on some key points, but I've been told I'm taking too long as it is, so we're going to move forward. With that, if I might, Madam Chair, I'd like to just recognize, as I said at the outset, the presence of the co-chair in this process, Jeremy Farrer, who's worked for many, many years very closely with this region, is now the chief scientist of WHO. And if you might indulge a minute to Jeremy to say any word he might in reflecting on this process.
Остались некоторые вопросы, которых необходимо обсудить. Об этом доложит господин Шуранов.
So, thank you very much, Madam Minister. As we are about running out of our translations, so let me give the floor to Gabriel. And probably we need to have some slight adjustments to our agenda. Yeah, but we're out of the translations now. Out of the translations. Yeah, we're out of the translations.
Thank you very much, Madam Minister. Thank you, colleagues. Professor Farrer, if I understand correctly, I'm sorry, I can't see you from here, but if I understand correctly, you are with us in the morning. So if I could please suggest that perhaps you might share some remarks with us in the morning. And we also have the intervention and statement from our EB SCRC link, Dr. Vesna Petric, in the morning session when we have interpretation. So if I understand correctly, before we conclude, Poland has requested the right of reply, and then we have some housekeeping messages. Poland, the floor is yours.
Thank you very much, Chair. Referring to Russian intervention on NCD office before lunch, we wish to exercise our right of reply on behalf of the group of 29 like-minded member states who supported the request to relocate the NCD office to the WHO Regional Office for Europe in Copenhagen for safeguarding the NCD's work. The direct and indirect health impacts of Russia's illegal and unjustified aggression against Ukraine is of our utmost concern. It is without a doubt justified that these issues, including the decision of the Regional Committee for Europe to relocate the NCD office from Moscow to the WHO Regional Office for Europe in Copenhagen, are addressed by WHO European Region member states. The decision is in line with the rules of procedures and supported by a majority of the WHO member states in the Euro region. It should therefore not be questioned. The decision was taken to safeguard and ensure sustainability of the NCD office technical activities. Thank you very much.
Thank you very much, Poland. And due to technical issues that we don't have translations and your statement is not available for other delegates in other languages, so we propose to repeat your statement in the morning to make sure that every delegates will have appropriate translation. So for now, Russian Federation raised the name plate. So again, we don't have a translation, and we can give you floor right now if you can speak Russian. So we probably will need to continue it in the morning. Thank you.
Thank you, Mr. President. We will exercise our right to reply tomorrow then. Thank you.
Thank you very much, Russian Federation, for your understanding. And as we still have several issues to be reviewed, and we have some remaining issues from yesterday's session, I'll give the floor to Gabriel to inform us with the progress of informal consultations. Please, Gabriel.
Thank you, Mr. Chair, and I'll be very brief as I know buses are waiting for colleagues. So the consultations have continued today in relation to the revisions to the RD report decision that issued last night, and the revisions proposed by the Russian Federation for the SCRC report decision will issue now at the end of this session in hard copy and electronically. They will be available at the back of the room in English and in Russian. There will be an informal member states consultation on any remaining issues on these draft decisions at the morning coffee break in the Aspen Hall, co-facilitated by the Euro coordinator and by the rapporteur to this session of the Regional Committee. If colleagues have any questions, please, of course, contact me this evening. Thank you.
Thank you very much, Gabriel. And tomorrow is going to be a technical day, and we'll still have some things to do. So we'll have we'll give the floor to our speakers, including Dr. Vesna Petric, our executive board member, and the bridge between the regional office and the executive board. So, I know that a lot of our colleagues have been waiting for the day 3, and hopefully we will squeeze all our agenda into the last day of our regional committee. And please be advised to return back from the breaks and lunch breaks in time, in order we save our time, and we are not in order to not to waste our time in the translation. So by this, would you like to add something? No? And I would like to give the floor to the Madam Minister, to our President, and I will translate it into the English. Thank you. Пожалуйста.
Уважаемые коллеги, подошел к концу второй день полное обсуждение важных решений.
So, dear colleagues, we have come to the end of the day 2, full of rich discussions and important decisions.
Всех мы благодарим за очень продуктивную работу в течение сегодняшнего дня.
So we would like to thank everyone for your productive work during today.
Заседание закрыто, и мы вас ждем на приеме от имени мэра города Астаны.
Yeah, by now I'm announcing that today's session is closed, and we will wait and we will see you at the reception organized by the mayor of the capital of Kazakhstan, the city of Astana.
Мы хотим вас познакомить с лучшим театром оперы Астана Опера.
So we would like to see you all at the gorgeous opera theater in Astana Opera.
Мы вас там ждем. Приятного вечера.
We will wait you there, and have a nice evening. Yeah.